helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. Today I have Dr. Blaine Nease with me today from Cabell Huntington Hospital. You are a surgeon. You specialize in bariatrics, though.
Yes.
Meaning you provide a lot of weight loss surgeries.
That's correct.
Which, according to statistics, now seems like you might be, a hot commodity in demand. Last week there was a survey that was put out. It turns out West Virginia, now we're tied with Mississippi to be, one of the most obese states in the United States?
Yes.
And we are above the margin. What is it? Okay, let's see. The obesity in the 50 states of the United States, obesity rate is about 30% in the overall 50 states. Here, we have 35.1% of our people in West Virginia, they're obese. What does this mean?
Well, I think that means that 35% of our folks have an even increased risk at problems associated with obesity, diabetes, high blood pressure, high cholesterol, and all of those things that go along with that. That affects their everyday lives as well as affects their medical care, and so it can be pretty devastating.
And this is pretty huge because we were third last year, and now we're tied right there in first.
Yeah.
All right, so that's not a good direction that we really want to be headed. But say when it comes to weight loss surgeries, before we would go in for that, are we failing at every kind of weight loss there is, failing at exercise and eating right? Is that?
Yes, the patients who come for weight loss surgery have what we call morbid obesity or severe obesity. And so that means they're 100 pounds or more overweight. You can be 75 to 100 pounds overweight, assuming that you have medical problems associated with that weight. So we're not dealing with folks who are just a little bit obese.
Yeah, this is not like a cosmetic kind of thing where you just don't like your love handles. This is morbidly obese.
This is obesity that's causing significant health problems, and it is medically necessary to do the operation.
Now, and what's other criteria that you need to meet in order to get something like this done?
Well, we want to make sure that all the patients are psychologically ready for that, meaning that they don't have anything going on that is not treated psychologically, and that they're well prepared psychologically for this.
Right.
There needs to be a lot of education in terms of what to expect after surgery and how to do well after surgery.
And you insist that your patients get this education before going through the process.
Correct. We teach patients that this is a tool. And like any other tool, if you use the tool effectively and you understand the tool and you take good care of the tool, then usually you can maximize its use. So the weight loss surgery is a tool that allows them to make these different lifestyle changes in terms of eating better and hopefully increasing their activity, ultimately resulting in weight loss and improved health.
And I imagine weight loss surgery doesn't just have one phase. There are different kinds.
There are different types of weight loss surgery. All of them have the same real indications in terms of being a particular amount over your ideal body weight.
Right. Okay, and that doesn't have to do with candidates. You can do different surgical procedures.
Correct.
And what are the kinds that you do?
So there's really three major ones. The adjustable gastric band, a lot of people have heard of that. Then there is the gastric bypass, which is the kind of the classic procedure that most people are familiar with.
Yeah.
And then there is a gastric sleeve, which we just reduce the size of the stomach. And then there's an operation called a duodenal switch, which is not done near as often. It's more of a malabsorptive operation.
Now, is it you who typically says, okay, I advise that you get this kind of surgery, or do you leave it up to them?
Most patients come in with a good idea of what type of surgery they want.
What kind of effects they want? Okay.
Right. And so I think it's my job to make sure that they're making that choice based on, correct information. And certainly there are times where they may want one procedure, but we really think a different procedure is going to be better, and we certainly try and steer them in that direction.
Sure, because there are different side effects that maybe they won't deal with best, or maybe just the typical weight that they have, would you be able to get get better effects from a different kind.
That and different diseases. So diabetes might respond better to a bypass versus, say, an adjustable gastric band.
A lot of things to consider here, a lot of things to take into consideration. But how effective have you seen this?
In general, you can expect when you group all the procedures together, you can hope for about a 60% loss of excess body weight that's maintained.
Oh,
right. So if someone's 100 pounds over their ideal body weight, in general, on average, we can expect about a 60-pound weight loss that is kept off long term.
How quickly do they see results? I'm just very curious.
Well, you know, you definitely see results in the first month when you make drastic changes.
First month, wow. Well, Dr. Nease is going to be back with us next week on the 4 p.m. show, so you're going to want to tune in for more on that. If you need any more information, you just head to our website, WSAZ.com, click on that Moms Everyday tab, and then make sure that you download our Twitter app. That's Moms Everyday. We'll be back after the break. See you then.